let me share with you. Okay, estrogen is typically considered a female hormone, and because it's actually concerned with a lot of feminine traits related to whether it's menstruation, childbirth, breastfeeding. We talk about lactation. But however, estrogen is also present in men. Now, estrogen, although it's a good thing, but when there's too much of a good thing, it's not good. And the strange things, if we see nowadays, is what's happening is that younger and younger girls are having periods. Usually, optimally, we say it's around 12 and 13, but now we have younger girls having periods at age or even 8, 9, or 10. Another concern, a growing concern, is there's also a rise in obesity, as well as infertility and cancer. And if you actually try to connect the dots, there is a common link, and that is estrogen. Okay. So what is estrogen dominance? Estrogen dominance basically means there is an increase in estrogen in the body in relative to progesterone. So it could be that estrogen is normal but progesterone is low, or it could be progesterone is normal but estrogen is in excess, or it could be estrogen in excess or progesterone is low. In such a condition of imbalance, this will create a state called estrogen dominance. Progesterone also will increase to support the ongoing pregnancy. Okay? When there is estrogen dominance, what happens is that there is an excessive production of estrogen, and henceforth that can in itself also inhibit ovulation, and that's where you have issues with fertility. But because estrogen is also a hormone that causes cells to divide and proliferate, and this is where excessive amount of estrogen can have serious consequences on the body with regards to the risk of cancers. Okay. Now, in men, estrogen before puberty is almost the same level as the little girls, but after puberty, the testosterone level just exceeds the level of estrogen, and henceforth that's where you have the masculine-like features. And in these areas, as male testosterone increases, it's more or less sort of reaches to speak around the age of 30, and around 40, the male testosterone actually somehow get converted to estrogen through a process of aromatization, and this has an impact whereby then you have a lower testosterone level, and now the testosterone is becoming estrogen, and now we have issues of male estrogen dominance. In women who has estrogen dominance, among some of the symptoms that they normally complain of would be, why am I putting on weight, and why am I feeling tired and have this unexplained fatigue. There might be thinning of the hair. Other hormone imbalance associated would be in terms of difficulty in concentration. They have issues with sleep. If they are married, they also have issues with infertility, and not unusually so, if not treated also, then these symptoms may present with associated diseases. And what we're concerned about in women are conditions like disease of the breast, fibrosis disease of the breast, because estrogen causes, again, division in the cells that promotes proliferation of the cells. It can also cause growth in the uterus, like adenomyosis or even endometriosis or ovarian cysts, and whether it's fibroids or endometriosis or even breast cysts. Okay, no doubt they are benign, but not unusually also with age and time, there's also increased risk of cancers in the breast, ovaries, or uterus. Okay. So those are some of the serious consequences of estrogen dominance. But the other thing with estrogen dominance is also an association with thyroid disorders. Not unusually, when you have estrogen dominance, you also have an underactive thyroid because of the action of estrogen, whereby it actually causes productions of a protein that binds the thyroid. We call it T3, T4. So although you have the thyroid in the blood, but in actual fact intracellular, you're deprived. So that's where you have issues like thyroid disorders, where they have intolerance to cold cold, they have cold hands, they have cold feet, they put on weight again, they have irregularity in their periods, and of course fertility issues. Okay, now with regards to male estrogen dominance, the presentation is not that much different for women, whereby men also starts to have weight gain, particularly around the mid-belly. We call it the belly fat there. They might have some slight balding of the hair. Again, they'll have decrease in libido, tiredness, fatigue, lethargy. But the serious consequences of estrogen dominance in men that we fear most is, of course, linked with increased risk of cardiovascular diseases like heart attack, stroke, because again of the influence on the cholesterol production, whereby with an increase in estrogen and a reduction in testosterone, there's also an increase in the bad cholesterol, the LDLs. Likewise, also males with estrogen dominance have increased risks of stroke and Alzheimer's, and of course more what you call it seriously and not uncommon, also the risk of prostate also increased with estrogen dominance. Okay, to diagnose estrogen dominance is actually not difficult if you actually have an experienced healthcare providers that sees this and understands in terms of the symptoms that the patient has, or identifying the signs, as I mentioned earlier, where there is weight gain, where there is tiredness or lethargy or acne or belly fat, increase in BMI. But again, objectively, we can do what's available here in Malaysia is doing actually a blood test, and this is where we can get objectively measure the level of the estrogen to the progesterone, and also with other hormones associated with it. Because as I said, underlying to it, there might be other factors linked with estrogen dominance, such as an underactive thyroid function, or even an abnormality in the blood sugar levels, like the insulin and the fasting blood sugar, as well as in the cholesterol levels. So all these tests ought to be done in order to give the patient the best of care. So estrogen dominance is more common than you think, and literally affects millions of men and women worldwide. And there are many factors that's actually associated with that, and of course, one of the most important is as a result of industrializations, and that's where now we have GMOs products that are filled with herbicides and pesticides, and also lots of chemicals that are available in the plastics, in the plastic bottles, in the plastic drinks, in the plastic food, in forms of wrappers. Literally, even the paint, the air that you breathe has got chemicals, the water that you drink are laden with chemicals, the food that you drink are processed food, whether with nitrites or again with additives and coloring. So all these chemicals, they have an impact on the body where they can actually cause disruption in our hormones, causing hormone disruptions. This is where we get estrogen dominance. And at the same time, even certain drugs that you take, like certain antibiotics that you take, also can cause hormone disruptions and result in estrogen dominance. So that's the reason why it's scary. It's all around us, and it's happening every time, all the time, everywhere. But as bad as it sounds, it's actually preventable. In other words, it's up to us. It's up to you out there to make that decision, knowing that that although that it's actually common, it's actually also preventable. It's something that you can manage. And one of the simple way to manage it is actually to identify the root cause of it. That means make good choices, particularly in your diet, okay? Because that's important to make sure you have good whole food. Stay away from processed food, from canned food, from fast food, because they're all laden with chemicals. Make yourself happy. Don't stress yourself up, because stress is related to a reduction in hormone progesterone, because this is where the progesterone in your body is used to make cortisol, and if progesterone is low, you have an increase in estrogen. So how to manage stress? One simple way is time management. Plan your day, plan your week, plan your month, and this is how you will not be stressed up. As you can see that if you fail to plan, you definitely plan to fail. So to be successful, time management is important. Some people talk about managing stresses, seeing a movie, have a good laugh, maybe 30 minutes a day. Laughter is the best medicine. Or have an exercise, a regular one, whether it's yoga or Pilates. Other ways to cope with estrogen dominance, we talk about, that means ways to help your body detoxify. That means helping the liver, and in that way, in such a way, it's actually making sure that you have adequate nutrients in your diet. Again, we talk about liver, healthy food, your green vegetables, your grapefruits, your avocados, the cruciferous vegetables, whether it's your cauliflower, cabbage, broccolis. So these are good vegetables that will also assist the liver in the detoxification process. Taking supplements, vitamins, particularly your B vitamins, your minerals like zinc and magnesium, are very, very useful to, again, assist in the detoxification process and also to help in your body to help reduce estrogen dominance. And last but not least, it's important that if you do have an imbalance in estrogen where there is low progesterone, so taking bioidentical progesterones would be the choice, would be the first choice, rather than taking synthetic hormones, progestins, like that's available in oral contraceptive pills. So for those men and women out there with estrogen dominance and hormone imbalance, please consider bioidentical hormone replacement therapy, as those hormones are more natural. They are as if your body is producing it, and also it can be customized, personalized to the body's hormone levels that's required for you. With regards to male estrogen dominance, another common condition that might be related to male estrogen dominance would also be depression. Okay, so testosterone is very important for men. It's not just about for sex or libido only, but also for his mental health, for optimism, for confidence, for improvement in self-esteem, for decision making, for sharpness of the mind. So when the testosterone level decreases with age, or as a result of estrogen dominance, where the testosterone is now converted to estrogen. So with the decline in testosterone, this will definitely have an impact on the man's mental health. Alright, so with male estrogen dominance, definitely there will be a change in the male physically. So instead of having more lean mass and all the abdominal packs that we call the six packs, what's going to happen to males with high estrogens? They're going to have male boobs, they're going to have male belly fats, they're going to have more fats on the arm and also on the thighs, and estrogen, because of this, is not what we call a hormone which is particularly healthy for men. Definitely that also has an association with high risk of heart attack, stroke, and Alzheimer's, and of course we're talking about prostate cancers.